This is the QTV Nightly News, which is also on Q Radio 103.3 FM, and I am Loliam Camara. Thank you for joining us. Here are the headlines. After months of frequent power cuts disrupting homes, businesses, and daily life, particularly across the Greater Banjul area, the National Water and Electricity Company says electricity supply has improved significantly and is about 90% stable. Higher Education Minister Professor Pierre Gomez has outlined measures to address transport challenges facing University of the Gambia students following the move from Kanifing to Faraba Bantam. The Sheikh Zayed Regional Eye Care Center in Kanifing has commissioned a cataract surgery simulator donated by Help Me See to strengthen cataract surgery training. The Al Ihsan Foundation, in partnership with the Yan Taro Project, donated essential supplies and free medical care to patients at New Yundum Health Center in the West Coast region. In sports news, Gambia's Minister of Youth and Sports, Bakari Waibaji, held bilateral talks with India's Sports Minister Dr. Mansukh Mandavir on the sidelines of the Glasgow 2026 Commonwealth Games, which got underway today. Those were the headlines. Coming up next, the news in detail. Thank you for joining us. After months of frequent power cuts disrupting homes, businesses, and daily life, particularly across the Greater Banjul area, the National Water and Electricity Company says electricity supply has improved significantly and is now about 90% stable. Usman Jata reports.
For many Gambians, electricity is more than switching on a light. It keeps food fresh, powers small businesses, allows children to study after sunset, and helps hospitals and workplaces function. So, when the lights go out, life is interrupted. A tailor pauses work, a shop owner worries about spoiled goods, and a student waits for power to return before opening a book. After months of frequent blackouts, NAWEC says the country's electricity supply is beginning to return to normalcy. Communications Officer Buba Baji provided an update.
As I'm speaking, electricity, yes, we are stable. As of now, we are stable. Not like the crisis days, but today I can say we are stable. At least we are 90% stable. A lot of efforts. We've able to bring some of our generators within the OMVG. Also, the trade between the member states also of energy have also improved. And then yes, the demand. We've got more capacity, both internal and external. That brought everything good for us now.
Between April and July this year, the Greater Banjul area experienced some of the worst power disruptions in recent years. Businesses counted losses, families endured sleepless nights due to the heat without being able to use fans or air conditioners, and many questioned whether the situation would improve. Mr. Baji explains that the disruptions were driven by a combination of regional energy supply challenges and major maintenance work on the national network.
What happened exactly was, we were on a major maintenance when the crisis also happened. And then we also have a serious shortfall from our regional energy that we get. So when we got that, it becomes a problem. And then it was definitely at a point where we have very limited capacity. The demand was definitely higher than the supply. So that gap was very difficult to meet. So we couldn't meet that gap at that particular time.
As frustrations grew, many also questioned whether the country has enough generating capacity to meet the growing demand for electricity. Mr. Baji responds to those concerns and explains NAWEC's current power generation capacity.
What we need as of today, it was 110, but these days it rises to 120. So let's say we need 120 to meet the total demand. Yeah, and then, but at peak period, normally we would have around 110, 115. So at least that's why there is some load shedding somewhere. But as I'm saying, with all the supplies coming in and out, yes, we are fine. Yesterday, as of even yesterday, we have over 120 megawatts, so we're good.
Despite the energy challenges, the government has frequently stated that it remains committed to achieving universal electricity access by the end of 2026.
As I'm talking to you today, there are villages that have been connected. If you go to the Fonyis today, the Kanjaminas and the Nambanjolas have been connected. If you go to URR, you have a lot of villages been connected. In fact, the remaining 10% we are expected, at least by December, all those works will be started or been finished in those areas.
The utility also provided an update on the country's 29 electricity feeder lines, saying they are now operational, improving the reliability and distribution of power across the network.
Everybody is connected to a feeder and they're divided into sections. So those 29 feeders, today as we speak, all the 29 feeders are on. Only 4 feeders out of the 29 are load shedded due to that their transformers are being overloaded, and then those works are also being done so that in the future we'll not have load shedding.
For many households and businesses, stable electricity means modern comfort. It means reopened workshops, preserved livelihoods, children studying without interruption, and renewed confidence that the lights will stay on. Gambia residents will be observing the progress to see whether that progress can be sustained in the months ahead. Osman Jata, QTV News.
The Minister of Higher Education, Research, Science and Technology, Professor Pierre Gomez, has outlined government's efforts to address transportation challenges facing students following the relocation of the University of the Gambia's main campus from Kanifing to Faraba Bantang. Jacqueline Koli has the details.
The move to the Faraba campus, with Lot 1 campus being inaugurated in March 2024, as well as appreciation for vastly improved facilities, brought some concerns from students. Many complained about the limited availability of buses transporting them to and from the university, often resulting in delays and overcrowding. Responding to the concerns, Professor Gomez says the government had a transportation plan in place from the onset of the relocation to support students' movement between the campus and surrounding communities.
Now we are spending close to 36 million per annum just to pay to GTSC to transport the students, and then the students in return they pay $10. So that's the situation. From Westfield or traffic lights to Faraba, or Faraba to traffic lights, they pay $10, and Gambia government will be paying $36 million.
Professor Gomez acknowledges the growing demand for transport services and says efforts are underway to further ease the burden on students.
GTSC is the one to provide 20 big buses every day to take the students to, and then we pay that amount. Yes, you will tell me it is not sustainable, and then we have good news. Good news also is, God willing, this year we're going to lay the foundation stone and start the construction immediately for the dormitories. That's going to solve the problem, because that will minimize the number of students, shuttling between Karaba, Westfield to Faraba, and so on and so forth.
As part of a long-term solution, the minister reveals further government plans relating to the Faraba Banta campus.
It's good news, and His Excellency President Arabaro has directed the Ministry of Works, and under the leadership of Honorable Ibrahim Asila and his team, they are really working hard, because they plan now to do an expansion of the road from Airport Junction to Block. So it means they will come and pass Faraba. And because of the number of people who will be going to Faraba, it's a justification now to expand that route. If you don't do that, you're going to run into problem in a very near future. So that's the reason why the Gambia government is already working on that, and Orobusila is really working very hard to ensure that this is real.
The planned dormitories and the expansion of the roads are part of broader expansion and development of the University of the Gambia's Faraba campus, all aimed at creating the most conducive learning environments for students. Reporting for QTV News, I'm Jacqueline Collie.
The Sheikh Zayed Regional Eye Care Center in Kanifing on Wednesday commissioned a cataract surgery simulator donated by Help Me See, a non-profit organization dedicated to eliminating cataract blindness through simulation-based surgical training. This story by Yafatu Gay is narrated by Usman Jata.
The simulator is expected to enhance ophthalmic training in the Gambia by allowing trainee eye surgeons to practice and refine their surgical skills in a realistic, risk-free environment before operating on patients. It also strengthens the hospital's position as a regional center of excellence for eye care training and innovation. Dr. Winston Cisse, Chief Executive Officer of the hospital, described the event as a major milestone for the country.
Yes, it's going to be a great game changer actually, because initially we used to do surgery on human eyes. That's where we start. So the fear is there of making mistakes, and the progression to is very slow because it's going to be a step at a time. But with this one, you can make mistakes, correct yourself, and repeat until you are satisfied that you have mastered that step. Whereas with human eyes, you can't do that.
The Help Me See simulator offers high-fidelity virtual reality training, instructor-guided learning, objective performance assessments, multilingual e-learning modules, and hands-on training in managing surgical complications and suturing techniques. Dr. Jean-Marie Andre, medical officer at Help Me See, highlighted the global impact of cataract surgery.
When sight is restored, two lives can change. The patient becomes independent again, and the family member can return to work, education, or normal life. This is why cataract surgery has such a great human and social impact. It's not only a medical act, it's an act that restores freedom, it restores dignity, it restores hope.
And Sumano Silla, former National Eye Health Program Manager, provided an overview of the partnership that led to the acquisition of the simulator and recognized the contributions of stakeholders who helped bring the project to fruition.
The declaration was signed by our health ministers, referred to as the Banjul Declaration. And this became the binding document where all the four countries agreed that the Gambia should coordinate the Health for Peace initiative with four components: human resource development, district support, going out to support other countries to develop district services, eye health services, and the establishment of a regional eye center. The fourth one being Sight by Wills. Again, the Gambia going out to support other countries to clear their cataract backlog.
Dr. Samate, Minister of Health, described quality health service delivery as a key pillar of national development.
What we give is based on what we have ourselves. It's based on what we know. So proper training is very important for every worker, but more so for health workers, because we can only treat people when ourselves were trained adequately to be able to do so.
The commissioning of the cataract surgery simulator marks a significant step in the Gambia's efforts to improve eye care services and train skilled ophthalmic surgeons to serve the country and the wider sub-region. Osman Jata, QTV News.
We will now go for a commercial break. When we return, we have more national and sports news stories. Do stay tuned. Welcome back, and this is QTV News. I am Loliam Kamara. Here are the rest of tonight's stories. The Al Ihsan Foundation, in partnership with the Yantaro Project, provided medical support to patients at the New Yundum Health Center as part of its humanitarian outreach program. The initiative included the donation of essential supplies and free medical care to patients. Sena Bucha was there and she filed this report.
Patients at the New Yundum Health Center benefited from a humanitarian medical outreach organized by the Al Ihsan Foundation in partnership with the Yantaro Project. The initiative provided personal hygiene products, nutritious food, free medical consultations, and treatment to patients. The Yantaro Project is a registered non-profit organization based in the Gambia that focuses on community development through education, healthcare, clean water, women's empowerment, and humanitarian assistance. The organization says its mission is to build self-sustaining communities by promoting education, economic development, environmental progress, and social welfare. Sheikh Isa Prime is the founder of the Yantaro Project.
So each packet that the patients will receive, inshallah, are a total of 8 items that will be received in the packet, bi-idhni Rabbi. In addition to, we know that when they come out, a lot of times they have to sit for a period of time as they wait on the queue. So we wanted to make sure that we provide some nutritious food in order just to supplement a meal, as well as today, inshallah, one of the biggest gaps sometimes between those who are receiving healthcare is the ability to afford medicine. So by the help of Al Ihsan Foundation, Brother Hadi, who's representing them, the patients today will be able to receive all of their medicine free. And so we thank Allah Azza wa Jal first, as well as the Al Ihsan Foundation. We are their partners, Yantaro Project here in the Gambia, and of course the New Yundum Health Team for supporting us in making this effort possible.
Al Ihsan Foundation Australia is an Australian registered humanitarian charity that provides emergency relief, healthcare assistance, food aid, clean water, orphan support, and sustainable development projects for vulnerable communities in Australia and overseas. Hadi Abdullah, International Project Manager, Al Ihsan Foundation Australia, spoke on behalf of the foundation.
On behalf of Al Ihsan Foundation, it's an honor to distribute these hygiene packs as a small gesture of care and support. And all our donors and everyone who made this initiative possible. We truly appreciate your efforts and partnership in serving this community.
Fatu Sanyang, Regional Principal Nursing Officer for the Western One Health Region, and Musa Kamara, Director of Western One Health Region, welcomed the support, describing it as a valuable contribution to improving patients' care and strengthening healthcare services.
On behalf of the Regional Health Directorate and on behalf of our Director and our staffs and members of the media, as I said, and the foundation, we sincerely appreciate your gesture. And as I said, we hope that this will not be first of its kind, and we assure you that whatever is donated here will be put into good use.
Taking this important milestone towards addressing the gap that exists in ensuring that infection prevention and control is minimally or controlled to a bare minimum, definitely is a gesture that we definitely reckon. And we thank you very much.
The donation brought much needed relief to patients by easing immediate healthcare needs, while reinforcing the importance of partnership in improving access to quality care and supporting the well-being of vulnerable communities. Reporting for QTV News, I am Sainabu Chow.
Coming up next, some sports news.
Minister of
The Minister of Youth and Sports, the Gambia, Bakari Waibaji, and Sports Minister of India, Dr. Mansukh Mandavia, had a bilateral meeting on the sidelines of the Glasgow 2026 Commonwealth Games. Our sports reporter, Mamadou Gajaga, reports from Glasgow.
The Gambia's Minister of Youth and Sports, Bakari Waibaji, and his Indian counterpart, Dr. Mansukh Mandavia, who doubles as his country's Labour and Employment Minister, focused on how both nations could strengthen cooperation in sports development. They also explored opportunities for collaboration and knowledge sharing in other areas, capacity building and enhancing sports development through ties between the two nations. The meeting is yet another indication of the Gambia's strong commitment to expand its wings in sports development through partnerships with nations which have better infrastructure, technical capacity and resources. As the Glasgow 2026 Commonwealth Games get underway later today, There will be many opportunities for similar engagements over the next 10 days. Umudu Gajaga, QTV News, Glasgow, Scotland.
Before we end, here's a recap of the headlines. After months of frequent power cuts disrupting homes, businesses and daily life, particularly across the Greater Banjul area, the National Water and Electricity Company says electricity supply has improved significantly and is now about 90% stable. Higher Education Minister Professor Pierre Gomez has outlined measures to address transport challenges facing University of the Gambia students following the move from Kanifing to Farababanta. The Sheikh Zayed Regional Eye Care Center in Kanifing has commissioned a cataract surgery simulator donated by Help Me See to strengthen cataract surgery training. The Al-Insah Foundation, in partnership with the Yantaro Project, donated essential supplies and free medical care to patients at New Yundum Health Center in the West Coast region. In sports news, Gambia's Minister of Youth and Sports, Bakari Waibaji, held bilateral talks with India's Sports Minister, Dr. Mansoor Mandavia, on the sidelines of the Glasgow 2026 Commonwealth Games. That story by Mamadou Gajaga brings us to the end of this news bulletin. Do join us again 8 p.m. tomorrow for more news. Thanks for watching.